This is a CBC podcast.
Well, regardless of that forecast, spring officially has sprung. And maybe you're like many people and you're itching to get out and go somewhere. Air Canada has announced it will resume some flights to sun destinations in May, and WestJet is restoring some domestic regional routes. So, what will be feasible if we are hoping for some kind of getaway? I spoke with travel journalist Jennifer Weatherhead Harrington.
Hi, good morning.
Now tell us, what are the major trends for this summer among Canadians in terms of travel? What are you hearing?
I think we're still going to see a summer where people are traveling domestically and staying within Canada. There will be definitely that group of people who want to get out there and do some international travel as soon as we can do that, and maybe once they're vaccinated. But I think most people are still going to be a little bit cautious and want to stay within Canada. We're going to see a lot of RV trips, a lot of road trips, camping, outdoor activities. Word to the wise, though, if you want to do any of those things, you should be booking them now before things book up or sell out. And I think in the future, later in 2021, 2022, you'll see those big, expensive, splurging, once-in-a-lifetime trips happening, because we are all so anxious to finally get out there and see the rest of the world.
Yeah, it's interesting. I read an article and they were referring to this travel, boom that's going to happen as revenge travel, because people have so missed traveling for the past year. And so that if they can, they will. Do you agree with that?
I totally agree with that. I think we're going to see it. Like I said, I think you're going to see those big trips. People missed out on vacations last year and most of this year, so they're going to want to splurge. You're not going to wait until retirement or wait for that big birthday or anniversary. I think people are going to say, hey, you never know what's going to happen in the world these days. I'm going to go out there and I'm going to do the biggest, best trip that I can do. So I think that will happen. Maybe not during the summer, but I think it will once people are vaccinated.
Yeah, and if people, want to be a little more cautious and they want to stay, domestic, what about the airlines? What are they doing in terms of interprovincial travel? Yeah,
so definitely we're seeing those pick back up. I mean, there was a lot of buzz and news around the fact that WestJet and Air Canada had canceled a lot of flights that were going into Atlantic Canada, let's say. Those are starting to open back up. So WestJet announced that they're going to restart some of those suspended routes to Atlantic Canada and Quebec City starting June 24th. So that will bring a lot of much-needed tourism back. And I think you're going to see that as the summer goes on. You're going to start to see those airlines going back to those destinations, which is fantastic, and it gives us an opportunity to see more of Canada, and it helps out every place that needs those tourism dollars. So I think we're going to see a little bit more of that happening, which is really great news.
A lot of Canadians missed their sun holidays this past winter. What about those? You think there'll be great interest in booking those?
I actually think there will be. I think we're going to see a little spike. Air Canada is resuming some of their sun destinations beginning in May. So I think people who are super anxious to get out there and feel like they can travel safely will go and do that. A lot of people will again start booking for next year. I think what you want to make sure that you do, no matter what you're booking at all this summer or into next year, make sure you have a backup plan and you read that fine print, so that way if you need to change, you need to cancel, or if something is canceled on you, you know exactly what you can do.
I don't know whether it's sort of all over the place, or do you know whether most, bookings would have a clause about free cancellation?
Yeah, so right now, most of the airlines still have that. You'll find it on all of their websites. They'll say that you have a one-time change fee, or you will get a credit to use for future booking if you need to cancel. Read up on that because it does change. I know Air Canada has been extending it, sort of month by month kind of idea, and the travel dates are also changing. So the onus is a little bit more on us as travelers right now to make sure that we are reading that fine print if you don't want to get stuck with something. But honestly, I think it's worth it for us to get back out there.
And what about safety guidelines, with air, train, even bus travel, given the fact that so many of us maybe by the summer still won't be vaccinated?
Yeah, so I think even when we do get vaccinated, I would expect to see masks still be mandatory on airlines, public transportation, and trains. So keep that in mind. They're definitely going to keep up with all of their health and safety checks. You can still expect to be, getting your temperature checked at airports for quite some time, I think, going forward, just because there are people who will be vaccinated and some people who won't be, and they're still learning a lot about this. So I would just kind of keep in mind that things aren't going to change in terms of those little bits in how you travel, but you can feel a little bit safer once you're vaccinated when you do it.
Have you heard anything about, mandatory vaccinations?
So that's interesting. I know a lot of other countries are saying that they will need proof of mandatory vaccination for people when they come in. And if you don't have that, then you would need to have, proof of that negative COVID test done 72 to 96 hours beforehand and possibly do a quarantine. So again, every country, every destination is going to be different. I'm pretty sure we're going to see the same thing across Canada in terms of one blanket idea. I'm not sure that individual provinces will do that. But I think, again, it's on the onus of the traveler to look into every destination that you're going to. You need to know the rules and regulations inside and out.
Mm-hmm. And what about U.S. border, cross-border holidays? What are you expecting there?
Yeah, so I know everyone's super anxious to get that border open, but I think the main thing that we're going to see is a lot more car traffic going across the border once it does open. Right now, obviously, we still have the mandatory hotel quarantine if you're flying back into Canada from an international destination. So that puts a damper on things that probably won't last through the summer. But once that border does open up, I think you're going to see a lot of traffic driving back and forth across the border. Shorter flights, I think, will also be most popular at the beginning because people will feel a little more comfortable taking a shorter flight. But I think, there's such a great relationship between the U.S. and Canada in terms of destination and vacation and tourism dollars that it might be a little bit of a slow start, but we'll see it pick up.
You know what? Just having this conversation, I think, will perk people up and get them thinking about holidays.
Oh, I hope so.
Thanks very much, Jennifer.
Thank you.
That's Jennifer Weatherhead Harrington. She is a travel writer and editor in Toronto. And we're going to have more on Air Canada and WestJet resuming flights once again when Frank Racco joins us with Biz Digest. Well, $186 billion. That's what the government has earmarked to carry Ontario through 2021. And there's the reality as well of a huge deficit for years to come. That's what we learned yesterday when Finance Minister Peter Bethlenfalvy tabled this year's provincial budget. So where is the money going and what does this spending mean? CBC's Queen's Park reporter Mike Crawley joins us to break it down. Mike, good morning.
Good morning, Mary.
Tell us about the big takeaways with this budget.
Well, for me, I think one of the things that's just remarkable about this budget is it's not just the size of the deficit this year because, COVID-19 is still affecting the economy clearly and there's still money that needs to be spent to deal with the pandemic, but it's the deficits that keep on going year after year until, a time when we're expecting the pandemic is well behind us. It's just striking. The other thing, too, is that there's not, even with all of the spending in this budget, there's not one big economic stimulus program to kind of supercharge economic growth. It seems almost as if the government is just going to rely on, consumer spending. There's certainly some pent-up consumer demand for all that money that people didn't spend on restaurants and travel and those kinds of things over the course of the pandemic with all the restrictions. But there's some money in here for small businesses and the tourism industry in terms of like immediate aid, but no big economic kickstart to Ontario's economy. And so, the government's looking at running deficits all the way until pretty much the latter part of the decade, which is, quite something for an ostensibly conservative government.
Yeah, I was wondering too. I mean, if they're looking at a projection of about 4% growth, right? Did they factor in the scenario that we are still in the pandemic, we're in a third wave, we've got these variants? I mean, what about future lockdowns? Did they factor all that in?
When you're making economic growth projections, I mean, generally speaking, what government will do is they'll take a sort of average of what all of the economists out there are saying, and then they'll kind of reduce it a little bit from that. So pretty much the economic growth projections are cautious. So I don't necessarily think they can be faulted for that. There is some question about whether they're actually allocating enough money to cope with what could come in the way of a third wave in terms of actually sort of spending within the hospital system. That's one of the opposition's sort of questions that they've raised. But there is some. They're allocating a total of about $7 billion in sort of one-time COVID-specific spending for this coming year. But that's down dramatically from what it was, this past year. It was about $20 billion in the past year. So, a significant drop-off in the COVID-specific spending, and yet still, a $33 billion deficit.
Yeah. What about what's in the budget for people who've lost their jobs?
Nothing specifically. It seems like the sort of the help for folks who've lost their jobs, the province is expecting that to come from the feds. There is one training program, a tax credit, effectively. The government will cover up to 50% of the cost of, or they'll cover 50% of the cost of job retraining, up to a maximum of $2,000. One interesting thing about that, though, is that it's only for people aged 26 and up, and yet, in the budget documents itself, it shows what a dramatically greater impact in terms of unemployment the pandemic has had on the 25 and under age group,
right.
Much more so than the older demographics. The other group that's been affected disproportionately by job loss in the pandemic is, of course, women. And there's a promise of a task force to look at the issues facing women in the workforce to make sure that they're not left behind in the economic recovery.
Mm-hmm. But nothing really targeted specifically to them, like immediate aid.
Not in the sense of money in their pockets or anything like that. The government's the government is putting money in the pockets of parents, and there's a little bit more daycare. The tax credit for childcare is a little bit larger this year, but there's not there's not a sort of specific job creation program or anything like that.
And what about the money in the budget for small businesses and tourism? How helpful will that be?
Yeah, so that's going to go specifically to the bottom line of small businesses and tourism operators specifically as well. That's really to help them with the kind of levels of debt that many of them have taken on. Something in the neighborhood of about 120,000 small businesses qualify for this funding. It's basically a repeat of the funding that was just offered in recent months, up to about $20,000 for small businesses whose revenue have been hit by the pandemic. The tourism money is there's also like a separate fund, a new fund for tourism related businesses, and that's important given that the much of the tourism industry, it's going to be limping along for quite a while now because the travel restrictions and things. People are not necessarily jumping back into traveling, and certainly not cross border. And so who knows when the tourism industry in Ontario is going to be able to get back on its feet.
Opposition leader Andrea Horwath took aim at what's missing from the budget. Here's some of what she had to say.
I think the government must have missed the memo because the pandemic is not yet over. The hurt hasn't stopped in our province, but this budget doesn't even mention the third wave, let alone help people through it.
Now, what are the main criticisms you're hearing from the opposition parties?
That what you just heard from Andrea Horwath was pretty much the thrust of her critique. That she's saying that Premier Doug Ford is acting as if we're done with the pandemic already. The Liberal leader Stephen Del Duca said that this is not the kind of budget you would expect to see to help us through a kind of once in a lifetime crisis like COVID-19. Both of the opposition parties criticized the fact that there's nothing in this budget in the way of paid sick days. I was never thinking for a second, really, that the government would all of a sudden reverse its policy on this because they just seem ideologically opposed to the idea of imposing a requirement for paid sick days on employers. There's no new real increase in spending in education, and that's received some criticism as well.
All right. Well, thanks very much, Mike, for giving us an update on the budget.
You're welcome, Mary.
That's Mike Crawley. He is CBC's Queen's Park reporter. And stay tuned. As you heard from Mike, there were two themes to yesterday's provincial budget, and that was health and economic recovery. Also, the government, of course, laying out $186 billion in the hopes that they're going to get both under control. We will have Finance Minister Peter Bethlenfalvy on the show right after 8 a.m., and he tabled that budget yesterday. So we will hear more about how that will affect the future of Ontario. Have you heard that home prices in Prince Edward County are up? Way up, as they are, well, just about everywhere in Ontario. What's driving this pandemic trend, and what does this mean for the local community? Treat Hull is a real estate agent in Prince Edward County, and he joins us. Good morning.
Good morning.
Tell us what you're seeing in Prince Edward County.
Well, you encapsulated it pretty well. Prices are going through the roof. Over the last year, depending on the measure you use, prices are up either between 30 and 40%, which, to be honest, is completely disconnected from reality.
Wow. And what are the reasons why you're seeing this?
There are a couple of things going on. It's obviously a question of supply and demand. Let's look at the demand first. The demand's coming from Toronto. Where else? And there's two things going on. There's a group of people in Toronto who have a real urgent need to get out of Dodge. They've just been cloistered up during the pandemic and have a real sense of urgency. I wouldn't call it panic buying, but let's say a very urgent sense about getting out of Toronto. And that kind of demand will pass, presumably, when the pandemic passes. In addition to that, there's a kind of a more long-run trend going on the demand side that's been triggered by COVID-19, and that's working from home. If you went back a couple of years, say in a couple, there might have been one partner who could work from home, but usually the other was kind of chained to a desk. It would have been very uncommon to have both partners could work from home, and now it's increasingly common. And given that, if you could both work from home, why wouldn't you do it in Prince Edward County, where the houses cost half what they cost in Toronto? And, you're in the beautiful outdoors, and the local wines are pretty good, too.
Mm-hmm. But who knows how long that'll last now if prices are going up. When you said an increase of 30 to 40%, can you give us an example of, maybe an average house price, what it was and now what it is now?
Well, if we take the average house price last year, so this is February 2020, average house price was $530,000, which was way up for us, compared to if you went back 5 years ago, 80% of the homes in Prince Edward County were under $300,000. And now, last year, the average price is $530,000. This February, it was $736,000. That's a 39% increase.
Wow. And then what does all of this mean for people locally, people who are in the county and perhaps they're hoping to get into the housing market?
To be honest, it's a social train wreck. We already had a severe problem of unaffordability, lack of affordable housing here in the county before the pandemic, and this has exacerbated it in a way that to a degree that no one could have imagined. It also, as home prices rise, unfortunately, that also spills over into the rental market, where there were very few apartments for rent or units available for rent in any event, and prices are rising rapidly there too. I
also wonder, when local people find that they're shut out of the housing market, of the rental market, and they see this surge that's coming in from Toronto and vicinity. I mean, how do they feel about that? What would they say is a leading question, Mr. Attorney, Ms. Attorney. They don't feel well. One of the things that's been attractive for both longtime residents and more recent arrivals here in the county is a very strong sense of community cohesion. It's a community that's been very supportive
mutually supportive, and those kinds of increases in prices, which are justifiably attributed to newcomers, coming in from the big city, undermine that social cohesion. And not surprisingly, not so much directly, but indirectly through the issue of short-term rentals, was probably the biggest single issue in the last municipal election campaign and continues to be a very politically hot topic.
Mm-hmm. Well, what's your advice to people, who maybe a year ago thought they might be able to buy in the county and now they find themselves priced out?
To be honest, there are more affordable geographies than Prince Edward County right now. Prices are rising all across rural Ontario, and obviously the county has a lot going for it. We love it here, as many people do, but from an affordability standpoint, by looking a little further afield, you can get more bang for your buck today. The other thing to bear in mind as well, many of the people who are buying homes now are of an age where they didn't live through the price crash in Toronto in 1990. And they've just had the experience of real estate prices going up and up and up, and they don't go up forever. In 1990, prices, there was a boom underway which turned on a dime and became a price crash. Prices fell for about 3 years, year on year in Toronto, and didn't recover to 1990 levels until 2003. That's a 13-year price correction. Will it happen? No one knows. Could it happen? It certainly could. And so for a discretionary purchase, if you've got to move, you've got to move. But for anybody making a discretionary purchase, one option is to sit in the sidelines and see what happens to prices, because there is a definite possibility of a cooling in prices.
All right. Well, thanks very much for filling us in on what's happening in your part of the province, Treat.
Well, and great to speak this morning. Thank you.
Thank you. That's Treat Hull. He is a real estate agent in Prince Edward County. Well, kayakers who head out on Ontario rivers are used to seeing a lot of the natural world, but our next guest says what he encountered when he went out for a paddle earlier this week surprised him. Colin Murphy is a resident of Leaskdale, that's just south of Lake Simcoe, and he's here to tell us the story of his adventure. Good morning, Colin.
Hello, Mary. How are you?
I'm great, thanks. So earlier this week, you were out for a paddle on the Beaver River. Tell us what you encountered.
Well, I paddling along, minding my own business, and I come around a bend, and I hear this, "Mah!" And there's a little lamb on the shore there, and he's obviously in the wrong place. It's a big cedar bush, and he's going up and down this little piece of frozen reeds that in the river, frantically looking for somebody, and I happened by. So I thought, well, this lamb doesn't belong here, so I pulled over to figure out what to do. And as I'm waiting to figure out what to do, it hops on my boat. It's right on the trunk. So I thought, well, that's solved. So I pulled off the shore, went down the river a little bit, got a couple of 100 yards before I got to some rough water, and I thought, this lamb's not going to make it through this water. So I had to do a little bit of gymnastics and flip the lamb over my shoulder into the boat so he didn't fall into the water again. So.
Oh, my goodness. And you're doing this all while you're paddling in the kayak. Did you get a good look at the lamb? I mean, what condition was the lamb in? What kind of distress? Well,
it was bleeding like a lot. Like it was a very funny sounding creature. So as soon as I got to it, it came right over, like it came and like right in my face, and it's like I'm patting it, going, "Oh, little lamb, what do I do with you?" And that's when he hopped on the boat. So we're going down the river, and he's cuddling me, trying to stay warm. He was a very friendly little lamb, I'll tell you.
And then how was he while he was in the kayak? Did he seem actually more comforted?
Oh yeah, he stopped making any noise. He was just like I said, he was cuddling up to me to stay warm, and I was patting his head when I could and avoiding flipping the boat.
And then, so you've got this lamb. Here you are paddling. I mean, what was going through your mind as far as like, what were you going to do with him?
Exactly. I was thinking, Easter's coming. No, I wasn't thinking that. There's, I'm familiar with the area, so I knew there was a lamb farm on the opposite side of the river, like a sheep farm. Mm-hmm. So I didn't know how far the river wound. I didn't know how long he'd be in the boat with me. So I got to the dam in Beaverton and pulled it up. I phoned my friends Sarah Cowley and Ron Baird, and they came by, and they said they picked up the lamb, and I said, I know where it is, and they said they know where it lives too. So they brought it there, and Pat, the owner of the farm, said thanks, and excuse me.
Oh, so that in fact was the lamb's home.
Well, it wasn't the lamb's home. The lamb was quite far away from where it belonged, but there's not a lot of sheep farms around, so we've just put it together that that's where it was. It was in a place a lamb should not be.
Yeah.
Yeah.
And then what did you hear from the family or the people who the lamb was returned to?
Well, it was apparently it was sort of their pet lamb. It was the one that hung around, and they patted it and fed it and all this stuff. And they knew something was wrong because it was missing in the morning, and the mother was freaking out trying to find her baby, and she was pretty happy to see it when I got it back.
Yeah. Do you know how the lamb got to where it was?
No, all I can speculate is that it must have got spooked, or that the sheep must have got spooked, and it fell in the water and managed to get to shore, but on the wrong side. So, and I guess it washed down. It did wash down quite a bit, and I think that's why the other sheep didn't bother pursuing it, because it was down the river.
Well, that's got to be the most unusual passenger you've ever had on your kayak, I'm sure.
100% most usual. Yeah.
And you posted the story of your lamb hitchhiker on Facebook. What kind of response have you had?
Huge. I've got everybody's making comments on it. I've got like 75 likes and 60 comments and a whole. I wish I'd gotten more photos, that's all, but it's kind of tough to...
Well, I think you had your hands full, Colin.
Yes, yes, I did, yeah.
Yeah, well, that was a wonderful good deed you did for that day, and I'm happy that the lamb has been reunited with its mom and its family. Thanks so much for telling us about this story.
Well, thank you, Mary. Thanks for listening.
That's Colin Murphy. He's a resident of Leasdale, Ontario. And one of the biggest challenges during this pandemic, as many of you know, has been the social isolation that we have faced. Seniors have been unable to be with family and friends. They're feeling lonely. And many students, especially those from other countries and communities, they're also feeling isolated. Well, why not bring them together? That's the goal behind Home Feast. It's happening tonight at 5 p.m. Nicole Norris is the manager of the Center for Change Making and Social Innovation at Georgian College in Barrie, and she joins me. Good morning, Nicole.
Good morning, Mary. How are you? I'm
fine, thanks. Tell us how serious the problem is of social isolation among seniors and students in Barrie.
Well, it's I wouldn't say it's massive, but it's enough to alert the City of Barrie and the Mayor's office and Georgian College to get together and figure out if there's something we can do about it, for sure. A lot of programs have been canceled for seniors. A lot of our students either in quarantine or the normal social life of college is gone. So we are finding that there's an uptake on mental health issues and different things, just with students wanting to connect.
So then how did the idea of Home Feast come about?
That's a great question. So Home Feast was sort of an evolution of another program we were working on, where we were looking sort of pre-pandemic to match students with adults 55 plus who had a spare room in their house It was modeled after the Toronto home share project that was quite successful and brought to Barrie. But obviously, as the pandemic happened, we couldn't do that, restrictions, lockdown, and we sort of ended up in a situation where, well, how can we continue to actually look at social isolation? And obviously technology was the route. So it was sort of one of these things where, as we were throwing the curve, we had to kind of keep thinking about how do we continue to solve this problem with the resources at our disposal.
Now, are you saying technology is the route because you're got these seniors who are matched with students, and technology is an issue for many of them?
Absolutely. So when we did a needs assessment, so as we were continuing to look at how we might solve this or how we might tackle it, we did a needs assessment with our seniors and caregivers in our community. And there were several things that came up. Obviously, some were around the house, help around the house, and we couldn't sort of logistically do that with the pandemic and the lockdown. But then the other one was technology. And so we have had seniors reaching out saying, I got a new Chromebook with my family, but I don't know how to use it. And so we started with this idea is, could we actually develop a program where we match a student with a senior? They work together on, sort of the technology piece. And then, could we put a goal in? And so that goal was could we get them to a point where they could have a feast together online? So they could actually use Zoom or different platforms, cook, and then come together and eat.
Okay, so then, what exactly happens tonight then with Home Feast? How does it all kind of lay out?
Well, absolutely, and we couldn't have done it without the support of the United Way. So what happens is we have our student and senior matchers, and they received meals. So they received meal kits, and they're actually going all out today. These were built by our campus pub, the last class here at Georgian College, so they're being distributed and delivered. And so they'll cook the hour before, and then they'll come online. We have a comedian, Andrea Murray, is going to be hosting. We have a local musician, Kaylee Hawkins, and we've actually got Jennifer Armstrong, the Honorable Colonel of Base Borden, doing our non-denominational blessing. And so everybody's just going to show up at 5 p.m. on the line. We're going to have a great opportunity with entertainment, meal, and just sort of eating together online. That simple.
Yeah, and you say that you're sending out these meal kits today that were put together by your campus pub. How much interest have you had?
Great. We've actually we've been able to sort of distribute 40 of the kits. So many of those kits will go to our students and seniors who are participating in the program. So there's no charge to those, making sure that they can participate. And then we called it to the community and said, if you'd like to purchase a kit or you'd like to gift a kit forward, we could do that as well, too. And so any of the proceeds from the kits are going to our student food locker to also continue to support our students in need. So we were pretty excited that we had about 40 kits go out.
Yeah, and I understand. I mean, you put all this together pretty quickly. What have you learned from this experience?
That's a really great loaded question. So many things. Obviously, we're an innovation center at Georgian College. We're one of 3. And we've learned that you've got to be able to pivot. You got to be able to flip on the dime. You need to recognize that building relationships is really, really important. Because when you throw wild ideas out there into the community, it takes some time for people to understand and sort of absorb that. The other thing we're learning a lot, too, is about, sort of working with Adults 55 and bringing seniors and students together, sort of that process, and actually how, it's just really, it's not even about the technology or anything. It's just about having a conversation. So just from that perspective, logistically, we've learned a lot. We couldn't have done this without our campus team. Yeah.
Yeah, it sounds like a lot of collaboration went on there.
Huge. It's massive. And the City of Barrie, United Way, massive.
Mm-hmm. So what are you hoping then that seniors and students and, even the community at large who are interested in getting involved, what do you hope they get out of tonight's Home Feast?
Well, I think the biggest thing for us is to show what's possible, to show that sometimes barriers bring our greatest ideas, and that we can do it. It takes a little bit of creativity, ingenuity, and passion. And we're hoping to continue the program, and we're hoping to inspire others and other communities to do it as well, too, at some point.
Yeah. Do you think that this idea might be expanded to other places?
I'm hoping so. So we're already sort of starting to talk to, we actually have 7 campuses at Georgian. So the great thing about that is we can actually expand it to each of our 7 campuses, which brings it into 7 communities as a start. And then anybody else who's interested who may want to talk to us and see what we did and how we did it, we are happy to share the entire process.
All right. Well, congratulations, Nicole, and good luck with tonight. I hope everything goes well.
Yeah, thanks. And if you're around 5 o'clock, come join us. It's on Eventbrite.
Okay. Nicole Norris, thank you. She's the manager of the Center for Changemaking and Social Innovation at Georgian College. Home Feast, the virtual dinner that pairs students and seniors, as you heard, happens tonight at 5 p.m., and it is virtual. Now, if you've been following the news on all of the COVID-19 vaccines, you might have gotten the idea that some are better than others. And if that's the case, well, why wouldn't you want to get the best? But that's not the whole picture. To help clear things up for us, family doctor Peter Lynn stopped by the show yesterday and spoke with Julianne.
Hi, Julianne.
There's been some confusion about the latest data about the Oxford AstraZeneca vaccine. What can you tell us?
Well, the first news was very good because their 32,000 person trial in the United States was finished, and over 20,000 people got the shot, 10,000 people got the placebo, and they reported 79% efficacy. So that means that the vaccine side had 79% less cases. So that's a lot better than the 62% that we were hearing from their very first study. So that was good news. And also, they didn't see any of those blood clot issues that they saw in Europe. So that's also good news as well. But a couple of hours later, the U.S. health authorities sent out a press release saying that the company had included outdated information. And that made me really confused because study data I didn't think was like milk, where it has an expiry date or something like that. So I didn't understand what they meant by outdated. So I remembered that this study was stopped in September of last year because one patient in the UK had some side effects, and so studies everywhere around the world with the vaccine was halted just to make sure that it wasn't related to the vaccine. In many other countries, 1 to 2 weeks, they started the study back up. In the US, the halt was for 7 weeks, so 1.5 months, a little over that, before they could restart again. And by the time they restarted, this is also the time that we started to see the new variants coming into play. And we know that these vaccines don't work very well against these new mutants. So as time went on, more and more mutants came on board. So I would assume that the vaccine is no longer protecting people as well. So therefore, we have this situation, had they not been delayed, their study would have been finished early. They didn't have to deal with mutants and they would have had very good numbers. So my guess is outdated means is that maybe they just sort of collected the information from the beginning portion of things and they sort of left off a little bit of the tail end because that's where the mutants would have been climbing on board. And so basically the regulatory agencies are saying, no, you have to include everybody. And by including everybody, that includes all of those people that were infected with the mutants most recently. So that's what the company is doing right now, is recalculating all of those with the addition of those people. And my suspicion is that they will release a number that is something lower than 79%. So maybe 74% or something like that. So the big news will be what is the percentage that they will get after they do all those new calculations.
What do you say to people who say, I want to wait to get the good vaccine or the best vaccine? What do you say to them?
Yeah, I have a lot of patients saying that. Now, the official public health position is take whichever vaccine is offered to you first. Now, their rationale is simple. 79% or even 62% protection is better than 0%, which is what you would get with no vaccine. So, but a lot of my patients are saying exactly, I'd like the 95%, because it's all over the news. So it's not, a hidden secret. And so therefore, both positions are correct and you can argue both sides. I think the thing that we need is how long do you have to wait? So if I said to you, you have to wait a year to get the vaccine that you want, then 79% protection right now sounds actually very good. On the other hand, if I said you just have to wait 1 week, I think most people will say, I'll just wait 1 week. So therefore, when vaccines are coming, how many vaccines are coming, are they coming to our neighborhood? Those are all very important information that we need to decide what to do. And so the Prime Minister announced, 1 million Pfizer dosages every week for the next little while. And so this is the kind of information that we need in order for us to decide should we wait or not. It's kind of like if you know that there's a sale coming, you're going to wait for the sale and then you buy it at that time, right? If you know that there's no sale ever, then you're just going to take whatever you can find. And so that's the same situation here. So the more information we pass out about the vaccine supplies, the easier it is that people can make the decision to wait or to get it right away.
Is there any group for whom it really matters which vaccine they get?
Yeah, initially, for sure, the seniors, because the AstraZeneca study trial they didn't have as many seniors enrolled. And so that became a problem because our Canadian immunization experts, the NACI group, they said if we don't know what happens to seniors, it's hard to recommend the vaccine to seniors. So that's why they said don't give it to seniors. And then the UK, they sort of went ahead and they were gung-ho and they vaccinated everybody from the oldest all the way down. And they started publishing information, real world information that says they were keeping these folks out of a hospital. And so once that data came out, then our Canadian experts said, okay, it's fine to give it to the seniors. So it looks terrible from the public's perspective, right? One moment you say don't do it, and then a couple of days later you say do it. So it looks like we're flip-flopping, and that's because the information was coming out so quickly that's why they were flipping back and forth once they showed that it was good for the elderly. But we do have people that may not make enough antibodies. So for example, if you're immunocompromised, so your immune system is not working well, either because of a disease or we've given you medication to suppress it, then you might not make all the antibodies that you need. So for those people, maybe we should give them the one with the better numbers. And also, if their immune system isn't working well, we don't want to use the vaccine that has the virus that carries the information in, because just in case the virus can do something, even though it's been disabled, we don't want to take that risk. For patients with cancer, they might not make as many antibodies. For elderly, they might not make as many antibodies. So maybe giving them the better numbers might be of some benefit. And in addition, we have to think about that 4-month delay to the second shot for these groups of people. So these groups that may not be making the antibodies enough, will they have enough antibodies to last into the 4-month period? So if I give you a shot, you might make 1,000 units of antibody. I give a 90-year-old, they might only make 200. And so therefore, will they make it to 4 months? So you may hear public health come back out and say, for certain groups of people, we'll give them the vaccine earlier, that second shot. And that way, everybody is sort of evenly protected and we're not putting anybody at risk.
On the other hand, there are people who might still be wary about the idea of getting vaccinated at all. How do you reach those people?
Yeah, and I mean, we see that even in the hospital, right? Yeah. We have reports that not everybody's been vaccinated. I mean, people are human, doctors, nurses, they're human. And so I have patients that don't want to get the shot, and they're not against vaccines. It's most of them have concern about the safety and the side effect profile. That's really what they're concerned about. So when I tell them, 3 million Canadians have had it, 90 million Americans have had it, all of a sudden they go, oh, okay, so it's been used on a lot of people and we didn't hear anything bad, so therefore it's okay. Also, if they have a family or a friend that has had it, that really helps a lot, because then they realize, okay, they got it, nothing bad happened, so I can get it as well. But if they really are adamant, I don't want this thing, then basically I tell them, okay, we just keep doing the things that protected you for the last year. So distance, mask, everything in full hilt. And in fact, even if you got the shot, you still have to do those things, because here in Ontario, the variant is very high. So therefore, we know that the antibodies that we make from these vaccines, they don't stick very well to the new mutants. So therefore, because the mutants are around, we still have to do distance, mask, all of those things, even though you get the shots. And for those where the kids have been yelling at them, sons and daughters, you must get this. I have a couple of, mothers that say, I don't want to get it, but my kids are, threatening me. If really they don't want it, just stick with that plan A, which is distance, protection, all that stuff. And then we tell the family members, don't bring your mother the virus. In other words, this is a thing that we discovered in the flu vaccination program, because with flu shots, the elderly, they don't make enough antibodies, some of them. And so what we started to do was vaccinate their kids and grandkids and stuff like that so that they don't bring them the virus. So we can do the same thing here, is recreate this ring, this wall around the person that's not vaccinated, and that way we don't bring them the virus in that sense. I guess the bottom line is that we want to make it very unfriendly for the virus. We want to make it difficult for the virus to set up shop. And we can do that with distancing, masking, and now vaccinating as well. Ideally, I would like that for everybody, all three of them. But if somebody doesn't want to get vaccinated, let's do the first two layers, distance and mask, and let's not bring them the virus. So we have to be super careful visiting them. And so therefore, we can make the virus very, very difficult to be able to set up shop.
Dr. Lin, thank you very much for this.
Thanks, Julianne.
That's Dr. Peter Lin, family physician and our CBC medical columnist. And he spoke with host Julianne Hazelwood yesterday. Protecting people's health and protecting the economy is how Ontario Finance Minister Peter Bethlenfalvy described the budget that he delivered yesterday. The steps the government is taking will involve running a $33 billion deficit and being in the red until just about the end of the decade. And still, there are many who think the government isn't going far enough. Minister Bethlenfalvy is on the line with us. Good morning.
Good morning, Mary.
I wanted to talk, first of all, about some of the things that weren't in the budget. Your government has been asked by doctors, public health officials, municipal leaders repeatedly to bring in paid sick days. With the province now in the third wave, why wasn't that part of the budget?
Well, there is a federal program right now that we help shape that is working. Over 250,000 of Ontarians have benefited from that program. It pays for 20 paid sick days, so it's working, and we encourage people to encourage all opposition parties and everyone to promote that program. You can get money very quickly. I've gone on the website. It's simple and easy. We worked with the federal government through our ministers to make it easier to access.
Yeah, Minister, are you talking about the CERB program?
No, I'm talking about the federal Canadian Recovery Sick Benefit Program. It's got over $1 billion available for all the provinces. I think just over $300 million has been accessed, so there's some $700 million available. Mm-hmm. As I said, 250,000 Ontarians have benefited. It has 20 sick paid days, and that's the program we got. It's working, and we encourage people to use that.
Yeah, I mean, the thing is, though, people still need to apply for that, and then they have to wait. And if people are sick, they need immediate help. Why can't you give them that?
Well, actually, you can get paid within 3 days, and it goes directly into your bank account. So,
yeah, there have been delays, though, with that.
Well, I'm sure, nothing's perfect. The federal government's doing a good job. They've done, we've worked closely with them. But, the number one thing, as you mentioned in your opening for our budget, is to vaccinate everybody, because the hardworking families right across this province, the workers, everyone, the best way to protect everyone, as you said at the outset, is to get the vaccines in people's arms. And that's why I announced $1 billion to continue that program, and that's the number one priority in this province, and we're going to keep doing that until the job's done.
Well, your government has also promised to improve long-term care by giving residents 4 hours a day of direct care, but that won't happen for another 4 years. I just want you to take a listen to what geriatrician Dr. Samir Sinha had to say about that.
I think many of us were hoping that they would accelerate that commitment to better staff our existing homes, because many of the folks who are currently living in our homes won't even be alive by the time those improvements are actually fully rendered.
Why is it going to take for another 3 to 4 years to bring in that standard of care that's so necessary?
So we are moving immediately. So I would just say that program is starting right now, and we'll ultimately get to 4 hours, which we've set aside $5 billion to almost $5 billion to get there. We're starting right now, including hiring and training 8,200 personal support workers. And I love this program because it's 12 weeks of in-class training, but we also are doing 12 weeks of experiential training, meaning in the long-term care homes, so that they can get that kind of, and similar sort of settings, so they can get that real-world experience. Because one of the big challenges, Unifor raised this with me, is the challenge is retention, and I agree with them. It's not just to attract, to train, but it's also, and motivate, but it's also to retain personal support workers. And this program, this 4 hours of care, which he mentioned, is the gold standard in Canada. No one else has that level of care. We're moving immediately and making sure that it's a rewarding career, and we're going to hire 27,000 personal support workers and nurses because it's the right thing to do.
Mm-hmm. Well, last year, now there was about $1.6 billion for the safe reopening of schools. Why is that funding not being renewed next year?
Well, we've got COVID funding that continues, and Mary, we've increased the education budget substantively in previous years and continue to increase the funding for the education system, and we're adding to it by also investing in remote technology, because this online option is something that is really important to parents to have the choice. So our number one goal was to bring children back to schools, but safely, with through the advice and the recommendation of the medical officers. And we've been able to do that. And many parents have told me that this has been quite good for them.
But what about direct funding?
Yeah,
what about direct funding for the pandemic for schools?
Well, we've put in, as you said, $1.6 billion. We've continued to set money aside for COVID, and the school year is not done, so we're continuing to spend COVID money. That means staffing. It means the cleaning. It means the PPE. It means on-site registered nurses administering PCR tests and rapid tests. Our number one goal for our children in school is that they can be in school safely, but also have an online option, because some parents for many reasons, we want to continue with the online option.
All right, Minister, I know you've got a very busy morning, so we'll let you go, but really appreciate your joining us this morning.
It's a pleasure being with you, Mary.
Thank you. That's Peter Bethlenfalvy. He is Ontario's finance minister and was talking about the new Ontario budget that was tabled yesterday. Right now, it is 8:17. Just want to let you know that today is the last day you can catch the Garden Sanctuary Art Show that is on at the John M. Parrott Gallery in Belleville. Now, it's a feat to be able to pull off any new project during this pandemic, let alone an art exhibit. Rachel Harbour is the artist behind the Garden Sanctuary Art Show, and she joins me now. Good morning, Rachel.
Good morning.
Well, today, as I said, is the last day of your exhibit. How are you feeling about the success of this project?
Oh, wow. I'm very proud of the whole thing, being able to pull it off in the time that I did. It was very exciting. And it's just been great to have the work there in the gallery because it's such a beautiful space. And to be able to share it and talk to people about it and do little tours and Zoom tours. Of course, we have the Zoom tours happening. So it's been terrific.
Mm-hmm. Well, I mean, I can't imagine, especially during a pandemic, how wonderful it must be for people to be able to see this. Can you paint a picture for us and describe what the works look like?
Well, the premise of the show was because everything was so just crazy out in the world, I found I was sort of paying more attention to the things in my garden. So we go through the seasons through these different paintings, watercolor and acrylic that I've done. Lots of leaves and flowers and different, looking really closely at things. There's also a bee. The bee has been a bit of a favorite for people. So lots and lots of color, and I have been told that people appreciate it in the middle of our COVID winter to be able to go in and see something colorful.
Mm-hmm. What actually inspired you to create this art show?
Well, it started with a conversation with Wendy Rayson-Kerr. She's a curator, acting curator at the gallery. And we were having a distant chat, and as we were talking, we were talking about things in the gallery and what was coming up. And I think from there, it sort of sparked this idea of what could be done. And in spending so much time in my garden, because we were all told to stay home, looking around closely at everything in the garden just seemed like the right thing to bring forward and to focus on at this time.
And do you have a connection to this gallery, the John M. Parrott Gallery?
I do. I've been teaching there for, I think it's about 3 years now. I do workshops on Tuesdays, and a great crew of people come in, and we work through a project, learning some new techniques, and everybody leaves with a painting. So it's just a great place to be, and I've really enjoyed all the people that I've met doing that, as well as the other locations that I teach, but most regularly at the gallery there, yeah.
Well, we've been hearing how the pandemic has been very hard on artists. How has it affected you and your work?
Well, I think it's that's a hard one to reconcile, because since I spent so much time teaching, that would often take over from my own art time. And so the pandemic, because of course my teaching traveling around, that stopped immediately. And so this has been a time where I've really spent a lot more time in my studio on my own work, and having that focus without any sort of pull in a different direction has been a bit of a gift.
So that's been kind of a silver lining. Yeah, sorry.
It had, yes. If we're looking for silver linings, that would be one of them, and I know that it's a very lucky thing to be able to do that. Yeah.
Do you feel then that time has really given you time to develop in different ways as an artist?
Yes, I would say so. I think it certainly allowed me the time to experiment with a few different techniques. I'm always in my teaching bringing in different things and saying, let's see what happens when we paint with a Q-tip. So bringing in some of those different approaches into my own work has really allowed me to pay attention to the details. And certainly when you see the work from the show, it is there's a lot of detail pulled out of these different images and flowers and leaves and things that I was looking at.
Well, I'm sure you've been a part or you've held art exhibits before, but what does it mean to you to be able to hold an exhibit like this during the pandemic?
Well, I think the first thing is that it's all the work that goes into making these things happen. Not just me as the person painting it, but everything they do there at the gallery to keep everybody safe and keep everything clean and to make sure that people can still come into the building. And they switched to a fantastic online sort of process so that even when the building was closed during our lockdown, you were still able to get onto the website and see work and be inspired and recognize that there's another life going on and there's other people creating and that community is still there. And it'll be there when all of this is done and we can get back to these beautiful places that we want to be.
And what about feedback? I don't know, is it possible to get feedback? Is there a way for people to let you know?
Well, people have been great with lots of nice messages that they've sent me through my Facebook page, but also through emails and just sharing their thoughts to the gallery staff. And then when I pop in there, there's usually someone has something nice to say, and that's always really encouraging.
Yeah.
Apparently there's online comments somewhere, but I haven't seen that yet.
Oh, you know what? I wanted to ask you that because during this time, many of us feel so isolated. And so, the ability to have that kind of interaction, right, with people who are looking and enjoying your art, that's got to mean a lot.
Yes. Yeah. It really does. And I think it's community, the deliberate community that we're missing, but also that inadvertent, who you bump into during the day, who you wave hello to walking down the streets or that sort of thing that I think everybody is missing. So it's been just a total gift to be able to have a little bit more connection through this show and being able to see people there at the gallery and hear from them.
And then what is next for you? Do you plan to start working on other paintings?
Oh, I always have. I'm here in my studio now, actually, and I've got a couple of paintings on 2 easels over beside me. There's always work going on, and I have, throughout the pandemic, I've been doing these little free mini projects. So I've got that I send out to people through email so they can keep their paintbrushes moving. And I've got 2 more of those on the go as well.
Oh, wonderful. Well, I'm just trying to imagine you right now with some paint on you, right on your smock.
So far today, I'm pretty clean so far.
Well, thank you so much for telling us about your exhibit, Rachel, and all the best to you.
Oh, thank you so much. It's my pleasure.
That's Rachel Harbour. She's an artist and workshop leader in Belleville. And today, as we mentioned, is the last day that you can view her artwork. It's on display at the John M. Parrott Gallery. For more information, you can visit Belleville Library. That's one word, bellevillelibrary.ca.
For more CBC podcasts, go to cbc.ca/podcasts.